Welcome to the Pain Literacy intro video. Throughout our education as health professionals, we've come to believe that there is one fix, one answer for when someone comes to us with pain. And that works for acute injuries or diseases. However, when we're looking at persistent pain, and when we're talking about persistent pain, I'm talking about anything that is over 3 months lasting, we need to look at a bigger picture. So we use our old knowledge in that old view of pain to work with them to find that elusive fix. And what we end up do is we unintentionally risk reinforcing their pain experience rather than helping to resolve it. And when we continue to frame their pain as a structural issue, most often we leave them confused, fearful, and stuck in cycles of treatment that don't really have any meaningful change with their experience. We need to see persistent pain as a lived experience that has been created by the nervous system and is influenced by many, many factors, including but not limited to biology, biomechanics, psychology, emotions, social pressures, workload, home life, everything. Pain literacy brings that new view of pain into the forefront of treatment. And this knowledge will fundamentally change how you listen and communicate with your clients and your patients. Telling someone that their spine is degenerating or unstable, a jelly donut, or out of alignment, it might feel neutral or factual to a clinician like us, but to a nervous system that's already on high alert, living with pain daily, these words can increase that fear and threat. Fear amplifies pain. Education, grounded in neuroscience, helps reduce that threat and restores a sense of safety and agency. But it's not that easy. We can't just tell people pain's in their brain because it's not, all right? But this course also lays that foundation of the mind-body connection and how this blends with pain neuroscience for the person in front of you. For people living with persistent pain, that protective system is now overprotective. Their nervous system learns pain is a good response, helps protect. But those neural pathways end up becoming more efficient at producing it, much like learning how to ride a bike or play a musical instrument, right? So this doesn't mean that the pain is imagined or psychological. I mentioned that earlier. It means the system is doing exactly what it was designed to do. It's just been turned up on high for too long. This helps us reframe our practice of care. Instead of chasing pain as a symptom to eliminate, we focus on challenging the sensitivity of the nervous system and restoring the confidence in movement and life. This opens the door for approaches that combine education, graded exposure, movement variability, emotional regulation, and nervous system regulation. It validates the client's experience while offering a hopeful and evidence-informed path forward. At its core, pain literacy brings humanity back into healthcare. It allows us to meet people where they are without minimizing their pain or catastrophizing it. It gives us a shared language to explain complexity without fear. It reminds us that pain is not a life sentence. Nervous systems are adaptable. With the right information, support, and care, people living with pain can change their relationship with their bodies and reclaim meaningful lives. For anyone helping clients in pain, learning pain neuroscience and mind-body connection combined isn't optional anymore. It's essential. So join me in the pain literacy course and start learning to connect with your clients and your patients.